For today's topic, we are going to go over the new Chief Financial Officer, the new CFO. And really, the point of this is really to look at the difference between the traditional CFO and the CFOs in healthcare and the difference in the expectations of these roles. So when we think of the traditional CFO, we think of the typical financial affairs officer, the one that is really dealing with all the financial information, record keeping, and basically all the financial affairs of an institution. And while this is true in healthcare, there are two major differences that are really relevant for you as you engage in the healthcare industry. The first one is about revenue and the way that revenue is captured and how revenue really is defined in healthcare and is driven by reimbursement. And that makes the healthcare industry really unique in that there's a lot of external influences as to what the revenue of an organization is. And there is very little control from the executive side as to what that looks like and when it changes. So that uncertainty is really part of what the CFO has to deal with and take into account as they make decisions. When we talk about the reimbursement and the external components of it, we're talking about the political, the government programs such as Medicare, bigger changes such as the Affordable Care Act. So there are a lot of external influences that may change quickly without the control of the financial officer. So that's one of the main differences. And the second one is really about the return on investment. When we think of return on investment, we think of a very straightforward formula of the return per amount that was invested on a specific technology, a specific monitor, or a specific operational change. Basically, that's really what you're looking at, and it has the formula tends to be kind of nice and linear, and we can agree that it's rarely like that in the real world, regardless of industry. But in the healthcare world, adding the idea of patients and what is on the line from a social perspective in terms of our responsibilities for the patient population and their health outcomes, it does become more complex. And it does give it a different timeline. It's a harder timeline to really set, which is also a big component of the return on investment. So those are the big two differences that are pretty key when dealing with the CFOs in healthcare. And the reason why this is important is because that really changes the role of the CFO and what they do strategically. When it comes to technology, the technology in healthcare tends to be a bit more interlinked across a lot of the domains, and more the CFO and also the investment of technology in healthcare is very, very large. So it becomes a very big chunk of that budget for the financial officer. So they have a seat at the table and a vote that weighs very heavily the idea of being a strategic role beyond the financial responsibilities is also something to consider as you're dealing with the CFO. And it's really about the greater expectations that the CFO in healthcare is faced with as someone who needs to make pretty strategic decisions that impact a lot of different parts of the organization. So they're essentially required to think bigger picture, think in non-traditional timelines. So what can you do today in order to really take a look at your solution and make sure that as you engage with the executives that you are truly messaging and positioning your solution adequately for the different perspectives? And when you review your messaging, it's really about making sure that you're articulating the value of your solution throughout the whole life cycle and creating a business case that links to the CFO initiatives. So definitely if it's a financial related solution that you have, you are going in knowing that it's going to resonate with them, but connecting it to bigger initiatives at the organization level is really key. Connecting across the different domains and the different executives is pretty essential, and really connecting to the bigger goals and vision. And at the end of the day, the biggest service you can do for your messaging and the way you're approaching and these engagements is to help them understand how you address uncertainty and how you work with the uncertainty of healthcare. That is an essential question that may not be articulated very well, that may not be part of the procurement process. It may not be mentioned through the procurement process, whether it's an RFP or a regular procurement process. So making sure that you're addressing that for them and giving them a better picture of how they're going to be able to handle and how your solution is able to help them handle uncertainty and the changes in healthcare is pretty essential. So that's the one thing you can do today, is to review your messaging and make sure that you are connecting to initiatives at the organization level, and that you are able to articulate how you address uncertainty with what you bring to the table. Thank you for your time today. For more content like this, and to see our upcoming events, check out our website, www.healthcaretechiq.com. Again, thank you, and until the next time.